Hello, I'm Lori Martin, and I'm going to tell you about my personal philosophy on healthcare and nursing. It's interesting that this is our subject for our YouTube assignment, and that as I'm transitioning into a new role, I'm actually asking myself this a lot, trying to figure out how to affect positive change for the patients that we take care of, and not only for the patients that we take care of, but for the staff who are taking care of the patients. My philosophy is happy staff do better patient care. And always, what are we doing? We are here to do good patient care. So if we can figure out how to put those things together, we always have a better outcome. Collective accountability. I love this new word. This is a new word for me. To me, it says that staff and managers, all of us, we are responsible and accountable to ourselves and to each other. That we're not waiting around for somebody else to fix something that needs to be fixed, that we are stepping up and taking care of business. So if you're a direct care staff person and you see another direct care staff person behaving badly, that you don't think, manager needs to come deal with that, that you pull that person aside and help them understand what it is that they're doing that might be a danger to the patient or cause a bad outcome. And then as managers, that a manager should be expecting that our staff can do good work, that we are not micromanaging them, that as managers we're not parenting, we're there to facilitate the good work that the staff are already doing so that good patient care can happen. I believe that people are doing best they can with the skills that they have, given what the world has thrown at them. If you think about things that way, it tends to help you look at patients and staff in a different way. When we think of somebody and think, oh, they're entitled, or they're doing this on purpose, or they're incompetent, or any number of kind of negative ways of thinking, your approach and your response to them is going to be negative. It's a lot harder to work with somebody who you think is just behaving in an entitled fashion than it is if you're working with somebody who you think, wow, they're doing the best that they can given the skills that they have. So oftentimes, if you think about it that way, that people are actually missing skills, that it's a skills deficit rather than somebody purposefully doing something bad. It truly changes the way that you think about the person, and you're able to work more positively with that person, be it a patient or a staff. So it was through Gonzaga University that I first learned about Greenleaf and about servant leadership. What was really great about it was that it felt like I was actually reading, something was describing exactly how I feel about my practice, my nursing practice, and not only in nursing, but the way that I feel in the world and the way that I feel like I should be. So learning about servant leadership was a really fabulous thing, and I think that it's the way that nurses should practice. Evidence-based practice. To me, it's sinful that it takes an average of 17 years for study findings to be put into practice. When I hear people say, well, we do it this way because we've always done it that way, those words should never be said unless they're followed with. And the reason that we do it that way is because the evidence shows that this is best practice. To take care of patients effectively, ethically, we've got to be looking to the evidence and make sure that we're doing this in the most effective way possible.